Good afternoon, everyone. Thank you for joining this National Council of Urban Indian Health webinar for our enrollment community of learning. My name is Kimberly Fowler, and I'm the Director of Technical Assistance and Research here at NCUI. Once again, thank you for joining us today, and I ask that if you haven't already done so, please provide your name and organization in the chat box located in the lower left side of your screen. So this community of learning is specifically geared towards assisters and navigators that are working on the ground to reach the uninsured. By providing you with relevant information and practical tips, NCUI aims to support you in being successful in your outreach activities as we prepare for the upcoming open enrollment period that is actually scheduled for November 1st, 2016 through January 31st, 2017. So please mark your calendars for these dates. Today's community of learning will feature a presentation from one of our urban Indian health programs, MATIVE Health in Phoenix, Arizona, and they'll be sharing with us on their best practices learned from hosting an Urban Day of Action for enrollment and outreach. All lines are currently muted. However, if you wish to ask a question, we ask that you place them in the Q&A pod that's on the lower right hand of your screen. At the end of the presentation, we'll provide time for these questions to be answered. So without further ado, I'd like to introduce today's presenters. First, we have Ms. Zipporah Fuller, who is the former Assistant Program Director of the CMS Connecting Youth to Coverage Grant at Native Health. She is the new Quality Improvement Coordinator for the organization. She'll be joined by Brittany Joe, a certified application counselor also at Native Health, who has been with the organization for 1 year and 5 months as an outreach and enrollment specialist. Currently, Brittany provides Arizona Medicaid presentations to the urban Indian Phoenix community and provides daily enrollment assistance to individuals. So just as a reminder, all participants are currently in listen-only mode. And if you do want to ask a question, please place it in the Q&A pod, and they will be answered at the end of the presentation. So Zipporah, I'll turn it over to you now.
Great. Thank you, Kimberly, and thank you to NCUI and all of the participants for allowing us to present on our Urban Day of Action experience. Today we'd like to discuss our event planning approach and strategies, and to also discuss the tools we use to design, market, and execute our Urban Day of Action. Throughout the presentation, we'll be referring to this as UDOA, just so that you have that acronym explanation. So to begin, again, we're going to go ahead and start with our Native Health background, what we do, along with a brief community statistics for those who are unfamiliar with Phoenix. We'll also move towards our goal setting, which is our planning roadmap, the event planning tools that we used, how we marketed our event, and the actual day of action. So that's just titled the Happy UDOA, and also share with you all our best practices and lessons learned. So to start out, Brittany's going to go ahead and introduce our organization.
Here at Native Health, our mission is to provide holistic, patient-centered, culturally sensitive health and wellness services. We have 3 locations within the metropolitan Phoenix area, 1 in downtown Phoenix, 1 in North Phoenix, and 1 information and referral center, which is located within a shopping mall. And our vision is healthy people and healthy communities. Here, our services are medical, dental, behavioral health, WIC, community and wellness division, outreach and enrollment, and an information and referral center. Here are some photos of the Native Health Central location and our community garden. Also, some photos of our Native Health West Clinic and the Information and Referral Center. Our community. Based on the 2010 U.S. Census, 2% of the Native American population live within Maricopa County. 40% are 25 years of age or younger. And based on the 2016 CDC report, 19.4% uninsured population live within Maricopa County. Arizona is a Medicaid expansion state, and Arizona's form of Medicaid is called Access. Access stands for the Arizona healthcare cost containment system. And if you take a look at the chart, we used 2015 data because at that time we hosted the Urban Day of Action. Each month, more and more people enroll in Access. Our community. Within our community, the 25 and younger population are the highest population in Maricopa County. Here are two examples of the age population within Access and also the race and ethnicity demographics. Data is provided quarterly, and as you take a look at the charts, it goes up every quarter. And based on data and people using our services, ZEP will go into how we use this information and creating our goal.
So based on the statistics that Brittany just mentioned, we felt like this would be a prime city to host an Urban Day of Action, which is also a reason that, a reason why we were asked to host the Urban Day of Action in the first place. With the percentage of uninsured folks, we made it our mission to target the uninsured American Indian and Alaska Native population. So it was definitely really good that the request aligned with our CMS Connecting Youth to Coverage grant. So the goal for that is to enroll 1,000 American Indian and Alaska Native youth care coverage. So again, anytime you can get your goals to align, you definitely want to try using a goal that gets both items, or any grant goals, any clinicals. You want to make sure that you can tie everything up into one big package, because it eliminates the need to create additional goals, creating more work for you. So with that being said, we'd like to move into our first poll. So the first poll asks, what goal setting strategies do you use? And you can choose more than one. So one of the options is SMART goal setting, the GROW goal method, and scenario planning, or do you just wing it? Okay, so based on the poll results, it looks like about half of you guys use the SMART goal setting. And a majority of you guys also use the wing it approach. So I'm glad that you're on the webinar. Hopefully we can provide you with some best practice for that. Give me one second. There's the screen. So moving forward, what we wanted to do was to really use an approach that was beneficial to our need to enroll uninsured individuals. So what we decided in regard to setting our goal is we asked ourselves, what do we want to accomplish? So we asked ourselves, what we'd like to do is create awareness about the importance of having health insurance, some education regarding what folks do once they're enrolled into a healthcare plan, and if they do make the decision to enroll into a healthcare plan, whether it be Medicaid or the marketplace. So even though we had that goal in mind, it was great, but it was still too broad. So we needed something that was more attainable, relevant, and time-bound. So if you guys aren't familiar with the SMART goal strategy, that's what the acronym stands for. So with that being said, our CEO and one of the individuals assisting us with this particular event thought, okay, well, you know what, 75 individuals sounds like an attainable goal. It's specific, it's measurable, and it's attainable. So we decided to focus more on the enrollment portion. So again, that was more of the relevant, because we could host this Urban Day of Action while also creating the opportunity for our CMS Connecting Youth to Coverage grant team to increase their numbers based on the Native American youth enrollment. Again, it was time-bound because all of this was to occur within one day. So since we had our SMART items in place, we thought, okay, well, great. How do we do this? Where will the event be held? Who will be involved? And what resources do we have? We also wanted to know how would we market the event. So all the questions might seem a bit overwhelming, but again, as you wonderful professionals know, we have to take one thing at a time. So what we did is we created a to-do list, and we actually wrote down, typed down all the ideas and comments that we were thinking of, and that would be a good best practice as well for you all, just to write anything that comes to mind. You could be at a grocery store and something comes to mind. Write it down on the receipt. No idea is too dumb, and a majority of the time, a lot of great ideas come from the smallest spots. So we tapped into the trustee planning method. These items meet our goal. We wanted to know how we could get participation, and this is geared more towards the internal. Trying to find partners. We really tried to find who the subject matter experts were, who we could ask to help us enroll, and we wanted to know, were we going to ask for sponsors? So those are some of the questions geared towards the participation. In addition to that, we also took a look at the program, and again, we figured, how is this going to meet our goal? We wanted to provide awareness and education, so we thought about the design. What do we want to incorporate? We could do speakers, we could do workshops, we could do interactive sessions, and how long would they last? Currently, the adult attention span is about an hour and a half, but again, do we really want to sit through a program that's an hour and a half long? We also thought about promotion. We needed to target the right audience because our quantitative is going to be coordinated so that it meets our goal or our purpose. We needed to ensure that all of the speakers, all of our educators, all of our sisters and navigators had what they need, talked about what their special approaches would be, anything that they did well. We wanted to bring that into our program. We also wanted to make sure that all of our clients and patients had access to appropriate material. As you just heard, we mentioned participation, program, promotion, and coordination. You can also look at that as production. So you could write that down as the 4 Ps of event planning. So our checklist, after considering the 4 Ps, looks somewhat like this. We wrote out each bullet point, the who, what, where, when, and why. So we focused then on the external portion of our event. We then looked at partnerships. Who locally what are the subject matter experts who are providing ACA information? What navigators could assist us in enrolling this large group of individuals? We looked at state, federal. Again, we also looked at event contact design and logistics. We looked at our budget. We also looked at our marketing. Based on our event goal of enrolling 75 individuals, we did decide to go with a smaller scale marketing. We didn't place a whole lot of ads out in the market because, again, our conference room only allowed for 80 to 100 individuals. We also wanted to, or once this checklist was made, we also wanted to make contact and set up a planning meeting committee. You do also want to be mindful of your external resources just as much as your internal resources. For example, as I'd mentioned, we did choose to host the conference here because our conference room was large enough to host about the 80 to 100 people, and it's also close to the Phoenix Metropolitan Light Rail and a bus stop for those folks without transportation. So with that being said, we move into the planning meeting organization. So we held teleconferences with our partners on a weekly basis. When we were approached to host this Urban Day of Action, we were about 2 months out from the date requested. So we figured, well, let's do the weekly teleconferences and let's host them for 30 minutes. I know that a lot of the partners that were included in our planning committee were C-suite people. They were administrators, so we did realize everybody is busy, trying to get stuff done for their organization. So the 30-minute meeting is actually a good time frame to plan your meetings for. We also had at least one organization representative. We also emailed the agenda beforehand or included it to the meeting planner. I'm a huge proponent of that because it also allows for people to see what's going to be discussed. And in the meeting planner, I'd also requested that if folks were unable to attend, that they sent me their updates so that I could provide that to the group. So just performing that small courtesy and asking for that bit of information does go a long way. I also emailed folks after the planning meeting. We did go over action items, to-do lists, any follow-up items that were necessary. We did send that out in a planning meeting minute form. And then I prefer more of the one-on-one follow-up with the actual individual versus sending an entire agenda to everybody to kind of look to see what they're going to do. A majority of the time, it gets lost within email traffic. So what I like to do is when I send out these emails, I'll put an asterisk right before the email and put UDOA asterisk and then put, action item list for, and then identify the individual's name so they know that it's something that they're going to be the lead contact for. In addition, this planning meeting keeps all of your moving parts aligned, and it keeps all of your participants informed. So it does sound like a lot, but you have to put in a lot of work for this huge event. So you really want to think about how you're going to approach any sort of planning committee. So with that being said, we're going to go ahead and move into poll question number 2. I'd like to know, what sort of event planning tools do you guys use? Do you guys use timelines? Do you guys use meeting apps? Do you guys use event planning and management software? Do you use matrix planning? And do you utilize free online guides? Like a majority of people use timelines, and it looks like they use meeting apps, and then of course matrix planning. So what we're going to go into next are the event planning tools that we used. Regardless of whether you create your own or if you find event planning tools on the internet, this is definitely a requirement if you want to organize a successful event. One of the tips that we used is, or found to be beneficial, is Googling project management tools. Offers really great templates. When you Google event planning technique or methods or templates, you're going to find it tailored more toward like weddings or like more intricate events. But I find that project management tools help you to align all of your projects in one matrix. So that's the approach we took as a project coordinator for this event, and of course me being an INTJ person, I created my own matrix tailored to my project style. So I would highly encourage you all, if you guys find a template that works for you, use it. And it could be your own one that you don't share with anybody else, but one that helps you to track what all of the components are, see where people are at. It helps you to stay on task and follow up on all action items. And again, you want to be simple. You want to incorporate only the important items. And again, rather than send a massive to-do list out to the group, excluding the meeting minutes, using tailored emails, it just makes it more personable, and it also helps to nurture your partnerships. For us, since we had the assistance of the navigator team, we also corresponded with that particular team one-on-one, and one of our partners within the local area, he was in charge of getting all of the CACs and navigators together. So he also asked for the email communication to go specifically to him so that he could then disseminate information. So as you communicate with your team members, you're going to start learning exactly what their communication style is. And that last bit down there, you do want to create a plan B for all tasks. As you all know, there are speakers who usually, who may cancel at the last minute or who are running late. So you also want to make sure that you have a plan to address that. In this next slide, we had an overall matrix that I'd created. And you'll notice that it was based off of function. It's got like the agenda, which is one project management suggestion, was to just list out how your agenda is going to happen or how it's going to occur. You can list it out as such. You can also break it out by logistics and then again create those individual columns for comments, who the assignee is, what the status update is for that, what the action item is, and again what the due dates are. So you're able to toggle and keep everybody informed. Again, this was made, but I didn't exactly use it. Our planning committee was exceptional. They were efficient at using meeting minutes to get things done, and we did a lot of the organization over the telephone via one-on-one conversations too. So I found that this wasn't really needed because everybody knew what they were in charge of and knew when to get it done by. So you want to, again, as I'd mentioned before, read your committee. You want to get to know their communication style and use that as an avenue to keep everybody abreast of all of their to-do or action items. The same goes for gauging your community. You have to know what style of marketing that your community wants or adheres to, things that they can identify with. So you want to see what sort of social media tools, what sort of marketing tools work best for your community, and Brittany will go ahead and go over that portion as to how we marketed our campaign.
How do we identify eligible individuals? We use data sources as follows. We use resource and patient management systems. We used Healthy Arizona system, which is also known as HEA+. This is the state Medicaid portal where all applications for access are submitted. We also use in-house referrals that are by both patient and provider requests. Individuals are able to sign up at the front desk and see one of the outreach and enrollment specialists. We also receive a lot of outside referrals from other health centers, resource centers, homeless shelters, behavioral health centers, and word of mouth from either family or friends. We also attend a lot of outreach events within the community. This is a great way to get our services out there, and we usually attend monthly events and do presentations as well as enroll on site. Our strategies. Our strategies were to use flyers. We also used mailers to uninsured American Indian and Alaskan Native population. We also got a lot of our information out to newsletters. We used our Native Health newsletter. We used the Arizona Alliance for Community Health Centers, Region 9, IHS listservs, and also outreach. We also have a patient lobby PowerPoint that is on a continuous loop where all of our enrollment services are listed. And here, Zep will go into our 2015 Urban Day of Action.
So this next portion is going to highlight how our 2015 Phoenix Urban Day of Action went for us. For the actual day, to give you a quick visualization of our setup, our clinic is 2 floors. The event was held upstairs in our largest conference room, so our enrollment occurred downstairs, which is also adjacent to our medical clinic. So our first floor conference room was used as an enrollment waiting room, and Brittany will actually go over that in just a moment. So before we move forward, I do want to take a poll and see what you would incorporate into your Urban Day of Action agenda. So what does your agenda look like? Would you do presentations only? Would you do interactive educational sessions only? Would you do speakers only? Or would you do a mix of the above? Okay, great. So it looks like everybody did choose a mix of the above, which is the same approach that we took as well. So this next slide gives you a glimpse of our agenda. I'm not sure if you guys can read the small print there, but What we decided, again, our approach and our goal was to create awareness, provide education, and an opportunity to enroll. So the first half was dedicated to speakers, just so that all of the speakers who were coming in had time to get to our healthcare facility. We are located in downtown Phoenix, so sometimes traffic can be an issue. In addition to that, a lot of the speakers who were coming from out of town preferred the early speaking time. We also did incorporate 3 educational sessions, and then we also put in some breaks for participants to stretch, grab a snack, or even network with the navigators and speakers. So the program was an intentional long program. You'll notice that it went from 3 p.m. to 7 p.m., a span of 4 hours. So we wanted to catch those folks who were either getting off work early or those getting off work late or who were on the night shift and were just now heading to work after the program. So again, we wanted to capture everybody and not just target one particular market. And then we wanted to carousel the education sessions as well, so that way people were able to catch the various educational ACA awareness informational sessions. So this is just our agenda, and we'll actually go over some of our lessons learned based off of our decision to set it up this way. So I'm pretty sure you're asking, how did they keep track of enrolling everyone? So we're going to move into our next poll. Do you guys have a triage slip created for large events, such as an enrollment slip? We'd like to get feedback from you as to how you identify those people who enroll, and then, of course, show you a triage slip. All right, so it looks like a lot of you guys don't have a triage slip. So what Brittany's going to go ahead and do next is she's going to go over the triage slip that we used. And this came from the Arizona Alliance of Community Health Centers. And she was on the floor utilizing this, so she is able to explain how this process worked.
Thank you, Deb. Here is an example of our triage slip that we used during the Urban Day of Action. So here, once the consumer entered the waiting area, they were given the triage slip to fill out. The slips were either numbered or lettered to designate where the person came from. We used numbers for the second floor, and we used letters to show that they came from the first floor. We created a triage slip that asked for their name, zip code, contact email, contact phone number, their household size, and annual income. From answering all of these questions, the triage person was able to determine what service would be best for them. The consumer was either referred to enroll in access, enroll in the marketplace, set up a follow-up meeting, or to apply for other benefits. Once the person was able to determine what service they needed, we had the triage person walk the individual to the service they were going to enroll in. And what was great about the triage slip is that we had this in both English and Spanish. And we had, during the Urban Day of Action, 3 certified application assisters enrolling in access, and 4 assisters were enrolling in the marketplace. And this ensured that the wait time was not as long. And access applications usually took about 30 minutes, and marketplace applications took about 1 hour. The day of preparation. Our AM prep, we set up a conference room, we set up triage and enrollment areas, we made sure to test AV and IT equipment, and we prepped and performed a dry run of triage. Also in the morning, the outreach and enrollment team met with all the other certified application assisters prior to the event to go over American Indian cultural competency with other non-American Indian assisters. This was to ensure that assisters were acknowledging the American Indian population with the best type of service. And throughout the day, we made sure to check the hospitality room to ensure that belongings were taken care of and secure, to make sure that the speaker reception was being set up, and we also made sure to have patient follow-up to ensure that their questions were being answered and that they were being satisfied with our event. We also made sure to replenish brochures and all materials and update on event data. This was number of attendees and number of enrollments. And our UDOA outcome, the attendance was about 115 individuals, and as far as enrollment, we had a total of 38 applications submitted. 81 uninsured individuals, adults and children, became insured. Of the above total, 28 applications were for American Indian and Alaskan Native families, and 61 urban Indians became insured. Our Urban Day of Action was successful, and Zep will go into best practices and resources.
So all the items presented today highlight some strategies and tools that worked for us. It's not to say that they're guaranteed to work for you, but they'll give you some ideas on a new approach or inclusion of a triage slip. They'll definitely give you some foundational knowledge base so that you're able to build on and take back to your healthcare community. So some of our best practices included using multiple strategies that allow for flexibility. Again, you saw that I had an overall matrix but didn't use it because you'll notice some trends will start to emerge, whether it be in communication, whether it be in program design. You just want to make sure that you stay flexible enough for those trends to emerge, because some of them will actually be better than the idea you first came up with. You also want to offer on-site enrollment. There were some facilities who did a speaking presentation session, but they didn't have enough navigators on site to enroll. So if you do have that partnership to bring more sisters on site, I would highly encourage you to offer on-site enrollment. You also should ensure that all of your materials are at the appropriate literacy level. NIHB brought some really great stuff, so did NCUI. They were very American Indian oriented, and it spoke to everybody within our population. Having the Spanish translations of all of our materials was also great. You also, again, want to prepare to make last-minute agenda changes. Always have that plan B. Double check your IT system capability and also confirm the needs of your enrollment team. This segues into that same IT system capability. Ask your oncoming navigator teams if they need laptops. Will they bring their own? Will they need access to Wi-Fi, or will they have MiFi? Will they need printers? You also want to do the same with your speakers just to ensure that everybody's needs are met. You also want to build and foster partnerships with local organizations. This was a great opportunity for us to reach out to additional organizations that we'd not yet worked with, so that also played into our best practice as well. You also want to promote a teamwork environment. Because we had so many sisters coming from different organizations, what we did is really try to receive everybody, welcome everybody, introduce everybody, and really try and get them connected to each other. Some light conversation at that morning session for the non-American Indian Sister training. We did have a little bit of an icebreaker at that as well. You also want to keep a follow-up blog for those that were unable to enroll, just so that you're able to catch those uninsured people and get them connected to resources.
Here are our lessons learned. We would have liked to reorganize our speaker session agenda. We would have liked to have speaker session instead of, sitting through multiple speakers all at once. And we would also like to have asked staff and volunteers to wear a company shirt or the same color shirt just to designate who those individuals are. Also, we would have liked to post the agenda in advance so that public would be able to see what session they would like to attend, and also to have an assister and CAC meet and greet. We We also want to have better clarification on Medicaid versus Marketplace application and host a non-AIAN volunteer assister cultural competency training days before the event.
So just to clarify, for the same color shirt, what we wanted and what we noticed is that participants didn't know who to go to because everybody was in business casual wear, so they weren't sure as far as like who to go to, and that's what our staff wears as well. And so some people were approaching like our behavioral health staff, some people were approaching our administrative staff. So having that same color really designates the sister and ACA expert. So you really should try and incorporate that into your event planning. And then with the agenda, any event somebody sees the agenda and they know, okay, well, session 2 is going to be on how to use my benefits. Let me make time to go there. It would have been a really great inclusion to our website had we posted the agenda. Aside from that, that concludes our presentation. Again, thank you to Nikui and everyone on the line for allowing us to share this experience. At this time, we're going to go ahead and hand it back over to Dr. Fowler to field any questions that you may have for us.
Thank you, Zeb. That was definitely a very informative presentation, and I know that you all put a lot of hard work into the preparation and the success of your Urban Day of Action. So at this point, if there are any questions from those that are participating on the webinar, we would love for you to place your questions into the Q&A pod located at the lower right-hand corner, or also in the participant chat, whatever is easiest for you. And while we're waiting for questions to come through, I wanted to mention that there will be a follow-up email after this webinar that will ask for your assistance in providing us with some feedback on how this webinar turned out as far as the information that was provided, as well as some new topics that you may want to hear in the future. So that SurveyMonkey will be coming out to you following this webinar, as well as it's being placed into the participant chat. If you need to jump off a little early, it's right there for you as well. I did want to mention also that this presentation was recorded and it will be archived on NCUI's website, which is ncuih.org. This webinar will be placed there in approximately 2 days or so, but you'll also receive the PowerPoint presentation in the follow-up email that you'll be receiving later on today. So if there is one question up if you're ready for those. Early Dawn is asking, did your CAC and Medicaid assisters bring their own laptops and Wi-Fi, or did you provide computer access?
We actually did both. I believe that there was one assister from an outside organization who didn't have a laptop, and we ended up providing them a company laptop, and everybody, again, was set up in designated areas, and then they just used the MiFi that we were able to provide. So it was a little bit of both. All of our assisters and outreach enrollment specialists have their own laptop, MiFis, and printers because they do go out off-site. So to answer your question, yes.
Great, thank you.
Sure, you're welcome.
I actually had a question from the previous slide when you were mentioning about having better clarification on the Medicaid and Marketplace applications. Can you dive a little bit more into that to help us understand what you meant?
Okay. What we meant with that is just to, when we were transferring individuals to enroll, I think it would have been very helpful to designate those type of programs, because people were being transferred like, I'm going to be applying for Medicaid, and they weren't sure because here it's called Access, and within the Marketplace, they weren't sure either what the Marketplace was all about. So it would have been excellent to, designate where they were going and designate those different types of programs, just to ensure that, that they knew the verbiage and were aware of what they were going into.
In addition to that, I think a lot of the individuals weren't aware that access was a part of the Medicaid plan. So I think that's what was also meant by that statement, is just that some folks thought, okay, well, isn't access a health insurance plan that's part of the marketplace? So it was really trying to educate them and make them more aware of the distinction between Medicaid and the marketplace.
I see. Thank you. We do have one more question coming from Clarita, who is asking, how was privacy of the applicants considered?
We actually had each of our navigators sit in available offices. So we used 4 of our outreach enrollment specialist offices in addition to mine. And then we also had 2 other administrators who were gone. So we tried to utilize space that wasn't being occupied at the time.
Great, thank you. And it looks like we have a few more questions coming in. But I did want to mention, as we're waiting for those questions to come in, that once again, open enrollment is just around the corner. So taking into account some of the best practices that Zep and Brittany has provided us, just keeping in mind that open enrollment is starts in November 1st through January 31st, 2017, excuse me. So it will be very urgent and beneficial for us to start planning for those days of actions or outreach days that your community could provide in order to get some additional folks enrolled into some of the health insurance plans. And it looks like that question didn't come through. But I would also like to provide information on how you can contact Zep and Brittany. Zep, if you wanted to go over that information for us.
Sure. You can reach me at zfuller@NACHI, also NACHCI.com. You can also give me a call. I can be reached at 602-279-5262, extension 3408. And you can also reach Brittany Joe, who's an outreach and enrollment specialist. She can be reached at brittanyj@nachci.com. And her extension is 3410. So if you guys would like copies of any of the event planning tools or the triage slip that we provided, please let us know, and we'd be happy to provide those toolkits to you.
Great, thank you. Once again, the presentation is being recorded and will be archived on the NCUI website. So definitely look out for that in the next coming days. I was trying to give a little bit of time for the one individual that's trying to type their question in. This is also information on Native Health locations in Phoenix. And also, if we do have a little bit of time, but if we aren't able to get to your questions, please feel free to just continue typing into the chat pod, and we'll have those answered for you individually. I'll send them over to Zep so that she can provide you with a response. So Julian is mentioning that she'll be going through the enrollment training in September for Medicaid with the state of Utah, and that's definitely a great opportunity for CACs or even those that are navigators in order to get updated on all of the new, if there's any new policies that are out from the previous year that have changed, in order to make yourself aware of those before the new open enrollment period starts. There's also the new assister training has opened up for next year. So if you are planning on continuing to assist people in the next upcoming open enrollment, you will need to get certified again through that process on the CMS website. Seth, were there any last comments you'd like to make before we close out?
No, I think that was it. Again, if anybody has any questions, please feel free to email those over to me. Aside from that, thank you again so much for allowing us to host.
Absolutely. Thank you. Thank you to everyone that attended, and we look forward to seeing you at our next webinar for the National Council of Urban Indian Health. Thank you, and have a great day.